This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Joining me, as often is the case, is one of the healthcare experts we call in from time to time, Dr. Stuart Shapiro. He's president and CEO of the Pennsylvania Healthcare Association. And one of the things, Doctor, that I want to get into this morning, it's pretty important. Pennsylvania has a lot of skilled nursing homes. It's hard to find somebody in some family who's not been in one, at some point. They're very important for a whole variety of reasons, not the least of which is the care that they provide. How healthy are they?
Well, Terry, thanks very much for having me as usual. And as usual, I'm going to be the umpire who calls the balls and the strikes
Okay,
and talks facts only. Skilled nursing facilities in Pennsylvania, there's about 700 of them.
Wow.
They care for primarily the elderly, except also a large number of disabled individuals. And they provide primarily two kinds of care. The first is care for people who need rehabilitation after leaving the hospital or after a fall, where they can get their strength back, learn how to speak better, learn how to walk better, learn how to just deal with the daily life. And they come in for a short period of time, usually paid for by Medicare, and go home. Mm-hmm. Then there's another group who spend a fairly lengthy time
long period
there.
Of time.
It's really been a shift, because 20 years ago it was all the people for very long periods of time. Now they're becoming rehabilitation centers as well as long-term care centers.
Right. Okay, so what exactly is the fiscal problem? I know that with funding, Medicaid, state funding, there's, I won't say controversy over it so much as it is just concern about the long-term fiscal viability.
Great. First, let me talk a little bit about the state budget. The governor announced his budget last month, said, I'm going to make care for the elderly, whether it's at home or in a nursing home, a priority. And he gave small increases in the budget. And the nursing home industry and the home and community-based industry was grateful for that, because those folks they're all providing good care. But when you look specifically at nursing homes, they are facing enormous economic challenges, because the reimbursement under Medicaid and the reimbursement under Medicare are barely allowing them to stay in business. And that's not just me talking. There have been two recent studies, one done by a company in Washington, D.C. called Avalier, which is made up of ex-federal government officials who used to run the Congressional Budget Office and the Office of Management and Budget, and they came to the conclusion that Pennsylvania nursing homes, their margins are almost unsustainable going forward.
And their profit margins, what they make at the end of the day.
And it doesn't matter whether they're a for-profit facility or a non-profit facility. It's what's left at the end of the day.
What's this about?
And that chart there shows that the tall blue stack showed a margin of 3.2% in 2007. The next blue chart shows that it's dropped by 63% and is now...
So for our viewers, the bottom line is they're barely sustaining their operations, and if things continue the way they are, some of these may go by the wayside.
Absolutely.
Is that possible?
And the ones that are taking care of high Medicaid population,
the more Medicaid people you have,
they're having margins that are razor thin. And what's happening to all of these facilities is they can't invest in new technology. They can't invest in capital improvements. And most of all, they can't invest in their people.
Yeah, I was going to say, you got to have skilled personnel in a skilled nursing home,
and
right?
you have to have consistent personnel.
Yeah.
And with the margins being so small and the Medicaid dollars not being there, the Medicare dollars drying up, what's happening is there's a high turnover, because the folks that are doing most of the work are looking to make an extra 20 or 30 or 75 cents an hour. The margin isn't there to pay them, so the turnover is high, and that affects the quality of care.
We're going to run. We're going to run to a break. The one thing I want to, when we get back into the next segment, I want to ask you is how endangered are nursing homes, in your judgment, based on what you've just said.
Great.
I mean, we have a huge senior citizen population. I think it's the third largest in the country. If staying as it is, I mean, could we lose 10 or 15% of the nursing homes? Is that conceivable?
We conceivably could lose some nursing homes. The issue is that there's a big gap between what care costs and what the state pays for that care. The governor in his budget proposed a small increase,
right,
but more is needed. So we're really saying to the legislature, you want to protect care for the frail elderly in nursing homes, you need to do two things. First is support the governor's small increase to cover some of the cost increases. And second, add a special fund, which the legislature added last year, that provides a small extra payment for those nursing homes that care for above average percentage of those on Medicaid. Last year, about $8 million was added. This year, we hope they'll add $16 million. But the best thing is, if the legislature adds $16 million, the federal government will kick in another $18 million.
Yeah.
And that'll really help those facilities that have tiny margins, have difficulty caring for any more people on Medicaid, which is forcing some nursing homes, and it's happening today, to say, I can't take another person on Medicaid.
You know, on a related subject, having been through that with my own mother who went into, a skilled nursing home, first of all, it's a tough decision for a family to make.
Absolutely.
I mean, to keep a family member in a home, to put them in a nursing home, I mean, it's gut-wrenching, let's be honest. It's not an easy thing to do. But then, when they go to a facility, that you want to be sure that they're getting the best care, and that's where this debate over the resources.
It's the only place to get 24-hour, 24-hour care, 7 days a week, 365 days a year. When you need to be in a nursing home, you need to be in a nursing home.
Are the technological changes also that are going on in medicine also part of the cost? I mean, more tests, they're more expensive. I'm not suggesting that they're not needed. I'm merely pointing out that the technology and all that helps drive up your cost as well.
It does, but also what's happening is the people are leaving hospitals much, much sooner, and they're going into nursing homes for rehabilitation. And if the nursing homes aren't there, they're going to back up in hospitals more than they are today, and they are backing up.
Yeah.
And it's going to cost the healthcare system more dollars because care in the hospital is 10 times as expensive as what it is in a nursing home.
What about no assistance from the federal government here? I mean, you and I have talked about traditional Medicaid expansion versus the governor's proposal. Both are popular, by the way, with the voters. Would either of those provide some help that you're talking about?
Actually, the governor's proposal, Healthy PA, will help long-term care.
Right.
Because it's not going to rob Peter to pay Paul. The Obamacare in its classic form, that form which enacted, which the governor says is not sustainable in Pennsylvania, and he's right, what that does is it takes dollars away from the elderly to provide dollars to the poor. And I think that is really robbing Peter to pay Paul, and it's not something we should be doing in Pennsylvania.
Yeah, we have about a minute left. I mean, I think the problem is when the governor submitted the Healthy PA plan, which is a plan that would allow individuals to take the subsidy and then go into the market and buy it, is that there's a work requirement in it that seems to be controversial. I think no other expansion plan has a requirement for work. Barring that, if it gets accepted, I mean, are you optimistic?
Look, everybody who's collecting workman's compensation today is required to search for a job.
We'll see
and that's reasonable.
Yeah. We'll see if HHS, that's where that happens to be, Health and Human Services. Great. Thanks for coming in for the update. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.